Dr. Clay Marsh is here, the COVID czar for West Virginia. West Virginia, by the way, a state with one of the most successful vaccination programs. More than 9% of West Virginians have received at least one dose. So we want to know how to do it better, and that's who we called on Dr. Marsh. Thank you so much for joining, Doctor. So your state is a leader in delivering these vaccines. You've administered 83% of the doses you have. Many states are struggling to give out even half their supply. What are you doing in West Virginia?
Well, Don, there's really four things that I believe that we're doing that's helping us distribute vaccines. Number one is we have a clear priority plan. We know that we want to save lives, reduce hospitalizations, make sure that we maintain the capacity and function of both healthcare and our communities. Number two is we've created a team of teams. We have an interagency task force that is led by our National Guard operations folks. And everybody that sits around the task force, whether you're in the DHHR, you're in the Hospital Association, Long-Term Care Association, you wear a West Virginia hat. Number three is we have an agile team. So we know that with this black swan event that is COVID-19, that we can't predict the future. So we want to make sure that we're able to pivot and be very agile. And number four is we understood the state of West Virginia. So we decided to take control of our state, where we knew we had half of our pharmacies being locally owned. So we did not activate the federal program and went instead with a program that really paired our local pharmacies with the vaccination places to be able to vaccinate quickly.
And you think that can be replicated on a nationwide basis?
Well, of course, but I would say that, you know, to be fair, we did what we did because we understood West Virginia. We're a small state, and people really do know each other. Every state's going to be different, but certainly, you know, creating that plan of clarity, your priority of who to vaccinate, that team where everybody can speak their mind and act as one, and then, you know, maintaining control of the vaccine doses and moving them quickly. Certainly, I think that's a recipe for success.
Okay, so I want to ask you more specifically about West Virginia, but since we're on the national level, I just, you know, some of these places, if you look nationwide, not necessarily in West Virginia, but they are, you know, at the end of the day, they're having extra doses of vaccine or what have you, people not showing up. Would it be prudent, or would it be possible to give the, you know, the number of people, if, you know, it's 65 or over or whatever it might be, allow as many people to come in until a certain time at night, and then past that hour, anybody who wants to come in until you run out of doses? Is that something that's, because I don't understand why they're not doing that, and they're just hanging on to these doses. And sometimes, you know, they're being lost, right? They're having to throw some of it away. So why not do something like that? Is that possible? Will that work?
Sure, it's possible. Here's what we learned, Don, from our experience. So number one is having clinics where people just show up to get the vaccines first come, first serve. That doesn't work very well at all. Many people wait almost all night and then don't get vaccine. Having clinics where people schedule a time works better. But we have started what I believe is the first program in the country where we're partnering with a digital identification and communication system called Everbridge, where we are now starting to pre-register every West Virginian in the state. And we're using an online portal and a phone portal for people that don't have that capacity to go online. But what we're doing, Don, is we're creating a sort of a large queue that then sits people in the queue based on our priority and based on when they put their name in the queue. And this system will interact and interface back and forth for them. And so we have backups that are available if our initial doses are not utilized. And having that backup plan, but staying within your prioritization scheme, I think is an important factor of success.
You just answered my next question, so I don't have to ask you. You answered both of them. Thank you, Dr. Marsh. Listen, I hope that the administration and the team who's administering you know, these vaccines, that they can learn something from West Virginia. Thank you so much. I appreciate it.
Thank you.